Common transducer types and the common exam application will be covered in this slide series. The versatile linear transducer creates a rectangular FOV. Using software on the ultrasound system, a trapezoidal shape is possible from a linear FOV. The trapezoid shape extends the FOV angle outward. Linear transducers tend to have higher frequencies and come in a variety of sizes. This transducer is typically used to image smaller regions on the body to demonstrate detail and composition of tissue and vasculature characteristics. A linear transducer is an appropriate transducer for examinations of the thyroid gland in adult and pediatric populations. A linear transducer is also a good choice for an ultrasound examination of the vessels in the neck. Musculoskeletal (MSK) ultrasound is a versatile application, and the linear transducer is a good choice for both the upper and lower extremities. The majority of MSK examinations require shallow depths and fine detail, so a high-frequency linear transducer with a small footprint is the ideal choice for musculoskeletal exams. In ultrasound examinations of the breast, a high-frequency linear transducer is an appropriate choice to show the detail and tissue composition. Other common applications for the linear transducer are peripheral vascular, as in this vascular exam of the lower extremity. Other common applications for the linear transducer are testicular, small parts, and point-of-care applications. Linear transducers are common in point-of-care ultrasound and used to assess lung dynamics, or as in the example seen here, needle-guided procedures, and here in the rapid assessment of a soft tissue injury. The so-called hockey stick transducer is a high-frequency linear FOV. Moreover, it is designed for very superficial imaging. Vector or phase transducer FOV. The acoustic field of this transducer originates at a small point and then fans out to a larger region of interest. The vector or phase transducer has a beam shape designed to allow scanning between ribs for cardiac exam applications. This transducer shape is also ideal for neurovascular imaging examinations. Transcranial Doppler uses this transducer to image the vessels within the brain. The narrow origin of the beam can penetrate between narrow foramina and areas where the cranial bone is thin. Additionally, this transducer can support abdominal examinations. In these examples, the clinician is using the phase transducer to scan between the ribs near the sternum of an adult. The FOV, shape of the housing, and small lens makes the phased array transducer the perfect choice for challenging echocardiograms. Choosing a phased array transducer for a pediatric echocardiogram can vary depending on the size of the child and if the child has complex congenital heart disease. Generally, a high-frequency phased transducer with a small footprint is a good choice. Complex congenital heart and postoperative examinations usually require a variety of low and high-frequency transducer selections. Volume matrix transducers. This volume matrix transducer is used externally on the chest, called transthoracic, TTE. This is a transesophageal transducer, TEE, that is used internally through the esophagus. For cardiology applications, there are volume transducers that create real-time, full-volume data sets. TTE and TEE transducers are used in cardiology applications to produce real-time volumes of the heart chambers for quantitative and qualitative valve analysis. Both the transthoracic and TEE create an FOV that is multiple layers. The layers have the two-dimensional depth and width collected across the thickness of the beam over the cardiac cycle, time. Multiple slice planes collected within a cardiac cycle form a volume of ultrasound data and volumes per second, instead of frames per second. The operator then dissects or renders through the planes within the volume to reveal the structural anatomy of heart valves and chambers in 3 dimensions. Volumetric TEE transducers have revolutionized cardiac valve surgery. Specialized en-face or surgeon views are rendered from volumes that show superior detail and help plan and execute surgical intervention. Curved FOV. Another common name for this transducer type is the curved linear because the elements are aligned linearly along the curved surface. The beam shape fans out to show the broad relationship of the organs to one another. The most common application of the curved transducer is the adult abdomen. The curved transducer is a common choice for obstetrics. The FOV expands wide with increasing depths, so the clinician has a wide view of the fetal anatomy. This clinician is using a wireless curved transducer during an ultrasound-guided musculoskeletal hip injection. The FOV of the curved transducer is also suitable for pediatric abdomen examination. The transducer that is appropriate for an abdominal ultrasound on an adult may be too large on the child's abdomen, and the frequency range too low for examinations on children. Depending on the size of the child, select a curved transducer with an appropriate footprint and frequency range for the pediatric abdomen. In a child's abdomen, a higher frequency curved transducer will provide a superior image of smaller abdominal structures of a child. As an alternative, if a high-frequency curved transducer is not available, choose a high-frequency linear transducer and enable the trapezoid setting to extend the angle of the FOV. Utilizing the trapezoid setting on a high-frequency linear transducer expands your transducer choices. High-frequency linear transducer with trapezoid FOV enabled compared to a high-frequency curved transducer. The FOV is similar and a nice adaptation for the linear transducer in the pediatric abdomen. Curved vector transducer. For obstetrics and gynecology applications, there are external and transvaginal transducers that create real-time full-volume data sets. Dissecting or rendering through the planes within the volume will reveal the structural anatomy of the uterus and fetal anatomy. Imaging near to the anatomy is the benefit of all intracavity transducers. Two-dimensional endocavity transducers also have a curved vector FOV and are used for transrectal and transvaginal imaging applications. Transrectal applications include prostate applications and transvaginal for obstetric and gynecological applications. Microconvex transducer. The shape of a microconvex, tighter radius at the origin and wider angle in the far field, greater than 110 degrees. The small abdomen of this child is an appropriate use of the microconvex FOV. The microconvex transducer has a small footprint, ideal for small windows or tight spaces between bone, and emits a very wide beam shape that fans outward. The microconvex is another versatile transducer. Other common applications for this transducer include the neonatal head, pediatric echocardiography, and peripheral vascular examinations. Non-imaging transducer. Sometimes called pencil probe. These dual-element transducers create high-quality continuous wave Doppler spectral traces. These transducers can assess gradients across heart valves, produce Doppler blood flow, non-imaging TCD, and Doppler characteristics for peripheral vascular applications. Typically, there is a frequencies range that is a selectable range of Doppler frequencies in non-imaging transducers.